Sure. Well, I think many people who are on this call, I recognize your names, and you may have attended events before. So with Sonia, I co-lead the network, and we're funded by UKRI. And you may already know, for some reason, Ellie, it's not moving anymore. I'm not sure why.
There should be arrows at the bottom of your screen, the bottom left.
No, not getting anything.
Clicking on the slide.
Yeah, thank you. So we are essentially a group of researchers, people with lived experience of loneliness, social isolation and mental illness. We also include policymakers and voluntary sector organisations and people who work with people who struggle with loneliness and social isolation and mental health problems. And as well as Sonia and myself, we have 10 co-investigators. And I think when we talk about multidisciplinarity later on, I hope that that is reflected in the co-investigators on this grant who come from a range of higher education institutions across the UK. So this is our second call, and when we were awarded this grant by UKRI, we were given £500,000 to essentially commission research. And in our first funding call, which we call the Pathways funding call, we were able to award up to individual projects of up to £30,000. And we recently tweeted about the projects that we've awarded money to. And now we've moved on to our second funding call, which we've entitled Interventions. And we're funding slightly larger projects. They're up to £50,000 each. And the smaller projects we would fund up to 15,000, and larger projects up to that upper limit of 50,000. And these are funded, as is normal with grants, at 80% of full economic costing. So if you were going for a small project and that the maximum and the cost was 15,000, we would be giving you essentially £12,000 for your institution to make up the rest. So people have got until 5 o'clock on the 2nd of October to make their application. So now what are we looking for? Essentially, we're looking for for projects that really address two different approaches: the prevention of mental illness by addressing loneliness, and the treatment of people with existing mental health problems using interventional approaches to address loneliness and social isolation. So these are the two broad areas we'd be particularly interested in seeing applications that relate to. And these can be at any level, and this is really to give you an example of interventions that one might evaluate at any level. So at the national level, you might want to evaluate a public awareness campaign, perhaps to destigmatize loneliness and encourage people to engage in interventions that address loneliness, individual level interventions. At the community level, I tweeted this morning from our Twitter account about the Chatty Bus initiative, which involves chatty bus ambassadors getting onto buses in areas like Plymouth and parts of Yorkshire and talking to people on the bus as a way of addressing social isolation and loneliness in that community. They might be interventions which are directed at a closed group. So for example, it might be an app that is offered to students starting a new college or a university that helps them connect with each other. Or it might be individual level interventions, such as a cognitive intervention that addressed cognitive biases that tend to reinforce a sense of loneliness. So what we're looking for is proposals that demonstrate, and these are the two things that we really do feel are important: integrating multiple research disciplines and incorporating the perspective of people with relevant lived experience. And I'll come back to that first point about multiple research disciplines in my next slide. And Jackie, I know, is going to talk about incorporating the perspective of people with relevant lived experience because she represents our co-production group. But we also strongly encourage cross-sectoral approaches. So if you're an academic in a university and you'd like to collaborate with a voluntary sector organisation, which perhaps already offers an intervention for people who experience loneliness, then we would really encourage those kinds of applications. We'd also really encourage applications that were led by early career researchers, because a lot of our work is about encouraging people in their careers to understand loneliness through their research. So what do we mean by multidisciplinary? Well, multiple essentially means more than one. So we're not expecting sort of 25 disciplines to be represented, but this figure really gives a sense of the disciplines that are represented in the co-investigators on our grant and the people who have been speaking at the events we've been putting on. And I just thought I'd give you a couple of examples. So we had a speaker earlier on this year who talked about a project on the River Foyle in Derry, Londonderry, and that was a fantastic example of how architects and urban planners had worked with, my slide just jumped, had worked with people who brought a more clinical psychology perspective to think about how the built environment in Derry, Londonderry could be changed to reduce the high rate of suicide there. So they were able to identify that there were certain parts of the River Foyle where people tended to spend a lot of time if they were contemplating suicide, and they designed some features of the built environment, such as pods that illuminated and were able to really communicate with people who were standing by themselves for a long time, messages that would be acceptable at a time when they might be contemplating suicide, and also to produce barriers on the bridges made of ferns, which were metal ferns, which were not a physical barrier as such, but were a cognitive barrier. So this, I thought, was a really good example of working across disciplines. I work as a psychiatric epidemiologist, which you can see at the bottom of this figure. And so if I wanted to work, for example, on a clinical problem like loneliness in middle-aged men, then I might use epidemiological approaches to analyze data to identify, let's say, risk factors for depression and loneliness in middle-aged men. And then I might work with somebody from a more sports psychology background and think about how we can design a sports-based intervention, or maybe working from somebody who works in the arts to think about appropriate intervention to draw in middle-aged men who have those characteristics of the risk factors for depression. So those are a couple of examples. And this slide really gives you a sense of the priorities that I've described. We're also particularly keen in projects that will address hard to reach groups. And we've talked about that in previous events, and also work that might pave the way for longer term, larger scale grant applications. So this is our website. Do visit it. And on this website, which is on the funding calls tab on our website, you will also see a link to the Slack channel, which is a way of communicating with people who are interested in applying for this call. So you can register at that link. A couple of questions we'd anticipate. We obviously got an October deadline. We'd expect to be able to communicate decisions to applicants by beginning of December, and the aim to start by the 1st of March 2021, certainly no later than the 1st of April. Projects can be up to 12 months long, and we really strongly suggest you COVID-proof your plans. And finally, this is a reminder of our website and of our Twitter handle, Twitter account, so that you can check for updates there. And Ellie is really our goldmine of information on this particular funding call.